Breakthroughs like mRNA cancer vaccines could revolutionize healthcare by targeting cancer in a precise, tailored way, giving us a glimpse of a future where cancer is not just treatable, but potentially preventable. We stand at the cusp of a medical revolution, where vaccines promise not just prevention, but also a cure. For decades, cancer has been a formidable foe in the battle for human health. But now, from the frontiers of science emerges a beacon of hope: cancer vaccines. Imagine a world where our own bodies become the warriors, trained to precisely target and eliminate cancer cells. This isn't science fiction. This is the future unfolding before our very eyes. Cancer vaccines represent a paradigm shift in medicine, harnessing the body's own defenses to eradicate the disease at its core. To understand cancer vaccines, we need to appreciate the incredible power of our immune system. Every day, our bodies wage war against foreign invaders, viruses, bacteria, and rogue cells that can develop into cancer. Traditional vaccines work by showing the immune system a wanted poster of the enemy. Cancer vaccines operate on a similar principle. They educate the immune system to recognize specific proteins or markers called antigens, unique to cancer cells. Armed with the right intelligence, the immune system becomes a formidable force, capable of seeking out and destroying cancer cells with remarkable precision. Don't forget to like, subscribe, and share this video with your friends. Drop a comment below and let me know your thoughts. The journey towards cancer vaccines is paved with the tireless efforts of countless scientists, doctors, and researchers. For years, researchers have understood the potential of the immune system to fight cancer. However, cancer cells are cunning adversaries, often evading the immune system's surveillance. The breakthrough came with a deeper understanding of cancer immunology, deciphering the complex language of cells. This knowledge, coupled with technological advancements such as mRNA technology, has propelled the development of cancer vaccines at an unprecedented pace. For years, scientists were baffled by the ability of cancer cells to evade the immune system's watchful eye, but with time and relentless research, the secrets of cancer's camouflage began to unravel. Cancer cells, in their uncontrolled growth, often express specific proteins or markers on their surface, their telltale signs. These markers act like fingerprints, distinguishing them from normal cells. Cancer vaccines work by shining a spotlight on these hidden markers, exposing them to the immune system's full fury. By presenting these unique markers to the immune system, we can prime it to recognize and eliminate cancer cells with pinpoint accuracy. The development of cancer vaccines has been propelled by groundbreaking technological advancements, particularly in mRNA technology. This revolutionary approach has ushered in a new era of vaccine development, offering unprecedented speed and precision. mRNA vaccines deliver genetic instructions directly into cells, directing them to produce specific proteins found on the surface of cancer cells. These proteins act as red flags, alerting the immune system to the presence of cancer cells. The beauty of mRNA technology lies in its versatility and speed. Once the genetic sequence of a target protein is known, mRNA vaccines can be designed and produced relatively quickly, making them ideal for targeting a wide range of cancers. One of the most exciting aspects of cancer vaccines is their potential for personalized medicine. Unlike traditional treatments like chemotherapy, cancer vaccines can be tailored to target an individual's unique cancer cells. By analyzing the specific mutations and protein expression patterns of a patient's tumor, scientists can design a vaccine that targets those unique characteristics. This personalized approach enhances the precision of the immune response, ensuring that the body's defenses are directed solely at the cancer cells, sparing healthy tissues. This can significantly reduce the side effects associated with traditional cancer treatments. Personalized vaccines can target multiple cancer-associated proteins simultaneously, making it more difficult for cancer cells to develop resistance. Don't forget to like, subscribe, and share this video with your friends. Drop a comment below and let me know your thoughts. The development of cancer vaccines has progressed rapidly from the laboratory to clinical trials, offering hope for patients battling a wide range of cancers. In one groundbreaking trial, a personalized cancer vaccine showed remarkable success in treating patients with advanced melanoma. The vaccine, tailored to each patient's tumor, stimulated a robust immune response, leading to significant tumor regression and improved survival rates. Similar trials are underway for other types of cancer, including breast cancer, lung cancer, and leukemia. While it's still too early to make definitive pronouncements, the initial results have generated tremendous excitement within the medical community. These trials offer a glimpse into a future where cancer is no longer a death sentence but a manageable condition, potentially even curable. The emergence of cancer vaccines marks a paradigm shift in the fight against cancer. This revolutionary approach holds the promise of transforming cancer treatment from a reactive battle to a proactive approach that empowers the body to heal itself. Imagine a world where cancer is no longer a source of fear and despair, but a manageable condition. Cancer treatment becomes less toxic and more effective, sparing patients the debilitating side effects of chemotherapy and radiation. Cancer becomes a preventable disease, with vaccines administered early on to eliminate the risk of developing certain types of cancer. The journey towards this future is ongoing, fueled by the tireless efforts of scientists, doctors, and patients who refuse to surrender to this devastating disease. The story of cancer vaccines isn't a sudden breakthrough but a tapestry woven from decades of meticulous research. It began with a simple yet profound observation. Sometimes the body could fight cancer on its own. Doctors had long noted rare cases where cancers would inexplicably shrink or even disappear completely. These spontaneous remissions provided clues that the immune system, when properly activated, could potentially eradicate cancer cells. Scientists began to unravel the intricate mechanisms by which cancer cells could evade immune detection. One of the earliest pioneers in this field was Dr. William B. Coley, who observed that some cancer patients who developed severe infections after surgery experienced tumor regression. Don't forget to like, subscribe, and share this video with your friends. Drop a comment below and let me know your thoughts. To truly appreciate the revolutionary potential of cancer vaccines, we need to understand the intricate workings of our immune system. The immune system acts as the body's defense force, equipped with a sophisticated arsenal to identify and eliminate threats. One of the key players in this defense force is the T cell, a type of white blood cell that acts like a highly trained soldier. T cells are equipped with specialized receptors that can recognize specific molecules called antigens, found on the surface of invaders like viruses, bacteria, and cancer cells. When a T cell encounters an antigen that matches its receptor, it triggers a cascade of events that ultimately leads to the destruction of the invading cell. While the immune system is a formidable force, cancer cells are masters of deception, employing a variety of strategies to evade detection and destruction. One of cancer's most effective tactics is to disguise itself as a harmless cell, hiding in plain sight among the billions of healthy cells in the body. They can achieve this by downregulating the expression of tumor-associated antigens on their surface, making them appear less foreign to the immune system. Another strategy employed by cancer cells is to create a suppressive microenvironment that dampens the immune response. They can release signaling molecules that inhibit the activity of immune cells, effectively disarming the body's defenses. Researchers developing cancer vaccines need to find ways to overcome these immune evasion mechanisms and awaken the immune system to the threat. The development of effective cancer vaccines has been propelled by a confluence of factors, including a deeper understanding of cancer immunology and advancements in genomic sequencing technologies. One of the key breakthroughs came with the ability to identify tumor-specific antigens, the unique molecular signatures that distinguish cancer cells from healthy cells. This was made possible by advances in genomic sequencing, which allowed scientists to decipher the entire DNA sequence of a tumor and identify mutations that give rise to these unique antigens. Another major leap forward came with the development of mRNA vaccines, a revolutionary technology that has transformed the field of vaccinology. mRNA vaccines work by delivering genetic instructions directly into cells, instructing them to produce specific proteins, such as tumor-associated antigens. This approach offers several advantages over traditional vaccines, including rapid design and manufacturing, making them ideal for targeting a wide range of cancers. While the concept of a universal cancer vaccine remains a distant goal, researchers have made remarkable strides in developing vaccines tailored to target specific types of cancer. These vaccines exploit the unique molecular signatures of individual cancers, training the immune system to recognize and eliminate these rogue cells with remarkable precision. Cancer is not a single disease, but a collection of over 100 different diseases, each with its own unique set of genetic mutations and molecular alterations. By targeting the specific vulnerabilities of individual cancers, researchers aim to develop vaccines that are not only more effective but also safer, minimizing the risk of harming healthy cells. This personalized approach to cancer treatment holds the promise of transforming the way we fight this devastating disease. Imagine a team of skilled detectives, each specializing in tracking down a particular type of criminal. That's the essence of cancer vaccines. Melanoma, a deadly form of skin cancer, has long been a formidable foe in the fight against cancer. However, the development of personalized cancer vaccines has brought new hope to patients battling this aggressive disease. One of the most promising advances in melanoma treatment is the development of neoantigen vaccines. Neoantigens are unique proteins found on the surface of cancer cells, arising from mutations in the tumor's DNA. In clinical trials, neoantigen vaccines have shown remarkable success in treating patients with advanced melanoma, leading to significant tumor regression and improved survival rates. These findings have generated tremendous excitement within the medical community, offering hope that personalized cancer vaccines could revolutionize the treatment of melanoma. Breast cancer, one of the most common cancers affecting women worldwide, has also emerged as a prime target for cancer vaccine development. Researchers are exploring various approaches, leveraging the power of the immune system to prevent and treat this complex disease. One promising strategy involves targeting HER2, a protein that is overexpressed in about 20% of breast cancers. HER2-positive breast cancers tend to be more aggressive and have a higher risk of recurrence. However, they are also more susceptible to HER2-targeted therapies, including vaccines. Several HER2-targeted vaccines are currently in clinical trials, aiming to stimulate the immune system to recognize and destroy HER2-expressing cancer cells. These vaccines work by presenting fragments of the HER2 protein to the immune system, triggering a targeted immune response. Early results from these trials have been encouraging, showing that HER2-targeted vaccines can safely stimulate an immune response, and in some cases shrink tumors or delay cancer progression. These findings provide a glimmer of hope that cancer vaccines could one day become a standard part of breast cancer treatment, offering a less toxic and more effective alternative to traditional therapies. Lung cancer, the leading cause of cancer-related deaths worldwide, remains a formidable challenge in oncology. However, the advent of cancer vaccines offers a ray of hope in the fight against this deadly disease. One promising avenue of research involves targeting specific proteins that are overexpressed in lung cancer cells, such as MAGE-A3 and NY-ESO-1. These proteins act like red flags on the surface of cancer cells, signaling their presence to the immune system. Vaccines targeting these proteins have shown promise in clinical trials, demonstrating the ability to stimulate an immune response and in some cases improve survival rates. For example, a vaccine targeting MAGE-A3 was shown to significantly prolong the time to tumor progression in patients with advanced, non-small cell lung cancer. While these findings are preliminary, they provide a glimpse into the potential of cancer vaccines to transform the treatment landscape for lung cancer patients, offering a less toxic and more targeted approach to combating this devastating disease. Section 5. On the horizon. Expanding the arsenal against cancer. The field of cancer vaccines is rapidly evolving, with new targets, technologies, and treatment strategies constantly emerging. Researchers are tirelessly working to expand the arsenal against cancer, exploring vaccines for a wide range of cancers, including prostate cancer, ovarian cancer, leukemia, and lymphoma. One exciting area of research involves combining cancer vaccines with other forms of immunotherapy, such as checkpoint inhibitors. Checkpoint inhibitors work by releasing the brakes on the immune system, allowing it to mount a more potent attack against cancer cells. Combining these approaches could potentially enhance the effectiveness of cancer vaccines, creating a synergistic effect that amplifies the immune response against cancer. Clinical trials are currently underway to evaluate the safety and efficacy of these combination therapies. The future of cancer treatment is rapidly shifting towards personalized medicine, with a focus on harnessing the power of the immune system to fight cancer from within. Cancer vaccines are at the forefront of this revolution, offering a glimpse into a future where cancer is no longer a death sentence, but a manageable condition, potentially even curable. Section 1. Safety first, navigating the landscape of concerns. When it comes to any new medical treatment, especially one as groundbreaking as cancer vaccines, questions about safety naturally arise. It's understandable to approach such advancements with a healthy dose of caution, wanting assurance that the benefits outweigh any potential risks. The landscape of cancer treatment has long been dominated by powerful therapies like chemotherapy and radiation, known for their effectiveness, but also for their often debilitating side effects. For many, the prospect of a vaccine conjures images of a simple injection, a relatively benign experience compared to the rigors of traditional cancer treatments. However, it's important to remember that cancer vaccines, while incredibly promising, are still a relatively new approach. As with any new medical intervention, rigorous testing and ongoing monitoring are essential to ensure both their efficacy and safety. The scientific community recognizes and embraces these concerns, prioritizing patient well-being above all else. Extensive research and clinical trials are meticulously designed to identify and mitigate potential risks, providing patients and healthcare providers with the information they need to make informed decisions. Section 2. A matter of perspective, weighing risks and benefits. Understanding the safety profile of any medical treatment requires a balanced perspective, weighing potential risks against the potential benefits. In the case of cancer vaccines, the potential benefits are significant, offering a new weapon in the fight against a disease that affects millions worldwide. Traditional cancer treatments, while often effective, can take a heavy toll on the body. Chemotherapy, for example, targets rapidly dividing cells, which includes cancer cells but also healthy cells like hair follicles and those lining the digestive tract. This can lead to a range of side effects including hair loss, nausea, vomiting, and increased susceptibility to infections. Cancer vaccines, on the other hand, work by harnessing the body's own immune system to target cancer cells specifically. This targeted approach is designed to minimize damage to healthy tissues, potentially reducing the severity and frequency of side effects. While clinical trials are still ongoing, the data so far suggests that cancer vaccines are generally well tolerated, with most side effects being mild and temporary. This favorable safety profile, coupled with the potential for long-lasting anti-cancer immunity, makes cancer vaccines an incredibly promising avenue for cancer treatment. Section 3. Beyond the needle. Understanding potential side effects. While the thought of a cancer vaccine might conjure images of a simple injection and nothing more, it's essential to understand that, like any medical intervention, there can be side effects. Most side effects are mild and short-lived, such as pain, redness, or swelling at the injection site. Serious side effects are rare but possible. Always inform your healthcare provider about any allergies. Section 4. The future of safety, advancing research and monitoring. The development and deployment of cancer vaccines are guided by a steadfast commitment to patient safety. Rigorous clinical trials are essential for evaluating both the efficacy and safety of these novel therapies, with patient well-being being the paramount concern. These trials are meticulously designed to identify potential side effects, assess their severity, and determine their frequency. Data collected from these trials is carefully analyzed to monitor for any unexpected or concerning trends, ensuring that any potential risks are identified and addressed promptly. Moreover, the scientific community is constantly working to improve the safety profile of cancer vaccines. This includes exploring new vaccine platforms, optimizing vaccine formulations, and developing strategies to mitigate potential side effects. The future of cancer vaccines is bright, fueled by a commitment to scientific rigor, transparency, and a patient-centered approach. As research progresses and our understanding of cancer immunology deepens, we can expect even safer and more effective cancer vaccines to emerge, offering new hope to patients and their families worldwide. Section 1. A dawn of hope. Cancer vaccines illuminate the future. As we stand on the precipice of this new frontier in medicine, it's hard not to feel a surge of optimism. For decades, the word cancer has instilled fear, uncertainty, and often a sense of helplessness. But with the advent of cancer vaccines, we are witnessing a paradigm shift, a beacon of hope illuminating the path towards a future where cancer is no longer a death sentence. The journey has been long and arduous, marked by countless hours of research and unwavering hope. It's a testament to human ingenuity and our relentless pursuit of knowledge. The promise of cancer vaccines extends far beyond treating existing disease. It holds the potential to transform our approach to cancer, from reactive to proactive. Imagine a world where we can arm our bodies to eliminate cancer cells before they take hold. This is the ultimate goal, a future where cancer is a distant memory. Section 2. Beyond treatment, towards prevention and a world without cancer. The implications of cancer vaccines extend far beyond the realm of treatment, offering a tantalizing glimpse into a future where cancer prevention becomes a reality. Just as vaccines have eradicated smallpox and nearly eliminated polio, could cancer vaccines one day render this devastating disease a mere footnote in medical history? While it's still too early to make such bold pronouncements, the scientific community is abuzz with cautious optimism. The same principles that underpin the success of traditional vaccines, training the immune system to recognize and eliminate specific threats, hold immense promise for cancer prevention. Imagine a future where routine vaccinations protect us not only from infectious diseases, but also from the threat of cancer. Children could receive vaccines tailored to their individual genetic predispositions, shielding them from the most common types of cancer. Adults could receive booster shots to maintain long-lasting immunity, reducing their risk of developing cancer later in life. This vision of a world without cancer may seem like a distant utopia, but the seeds of this future are being sown today. With each breakthrough in cancer immunology, each successful clinical trial, we inch closer to this ambitious goal. Section 3. The power of human ingenuity. A testament to scientific endeavor. The development of cancer vaccines stands as a testament to human ingenuity and our commitment to improving health. It's a story of collaboration, overcoming challenges, and relentless innovation. Despite setbacks, the spirit of innovation has prevailed. Cancer vaccines symbolize hope and a brighter future. They remind us that human ingenuity can achieve extraordinary things. As we celebrate progress, we honor those dedicated to this pursuit. The future of cancer treatment is being rewritten. Cancer vaccines are at the forefront of this revolution. It's a future filled with hope and potential cures. We move closer to a healthier, brighter future for all. If you enjoyed this video and want to stay updated on more game-changing breakthroughs in health and science, don't forget to like, subscribe, and share this video with your friends. Drop a comment below and let me know your thoughts. Are you excited about the future of cancer vaccines? Let's keep the conversation going.